Hi, this is Jessica DeMassa, and I'm here at Singularity University's Exponential Medicine 2017 in the GuideWell Insights Lounge. Joining me right now, I have Cory Kidd, and he is the founder and CEO of Catalia Health. Is that right?
That's right.
Very good. Thank you for joining us. And we are also joined by
Maybu.
Maybu. Okay, great. So you're going to have to explain a little bit what's going on here. What is Catalia Health? Who is Maybu? What's she up to?
So the quick introduction is that Catalia Health is a healthcare company focused on care management.
Okay.
And we have a unique approach to it. Maybu is our interface to patients. As opposed to a doctor or a nurse, our patients get Maybu at home.
Oh, that's very cool. At home they get her.
At home, that's right.
At home, okay. So how does it work exactly?
So if Maybu's turned on, which we've kept her quiet here for this interview.
Well, thank you, I appreciate that.
She'll just talk to us. Right, so she'll start off, oh, hey, how are you feeling this afternoon? Right, just wanted to check in on you. And depending on your answer, it might go off in many different directions from there. So the conversation actually gets tailored to a patient. Now we're dealing with chronic disease, so a lot of the information she's going to have is about whatever I'm dealing with that condition. Right? What do I need to follow up on? What advice do I need? What might I want to tell my doctor to get back to them? That's
awesome. And I guess is the idea that patients will interact with her more than with any other kind of interface?
So there's a couple things here, right? So if we compare to humans, that would be the ideal, right? If all of us can see a doctor or a nurse every day, if we're dealing with a chronic condition, that'd be great, right? But we can't afford that, right? There aren't enough people in healthcare to help the almost 50% of the population dealing with a disease. So we have that kind of comparison point.
Right.
So we're helping augment the people who are doing this. And on the other side, we've got a lot of other technology that's trying to help, right? Apps, of course, are very popular, very common,
right?
And no one uses them.
That's true.
and so the reason that we have this interface as opposed to an app is the same reason that we're all here in San Diego today. Right? Every talk here is being recorded.
Right.
It's going to go up online. I could sit back at home in my office in San Francisco and watch it, but I'm on the road all the time for things like this because face-to-face really makes a difference.
It really does make a difference.
Psychologically, we actually understand what that difference is in terms of face-to-face interaction versus something that's mediated in some way. And it turns out those differences carry over into the world of technology.
So how did you arrive at the design for this?
So a few things. There's some general principles that we figured out based on the psychology, like I've been talking about. For example, the eyes, right? She can literally look me in the eyes while she's talking to me. And that's a strong, powerful social cue.
Right.
Just like it'd be a little awkward if I just kind of stared off this whole time when we were talking. You could still talk to me, but it wouldn't be quite the same.
Strange, right.
So her eyes are important. Otherwise, size and shape is really about design, right? We want to fit it into our patient's home. Sits on their kitchen counter or bedside table.
Right.
So we had the general principles and brought in IDEO, the big design firm, to actually do the design of this product with us.
That's very cool. So I understand that part of what you've been doing with this, as you are a startup, is that you were a participant in GuideWell's Health Plus Excel program. Is that right?
Yes, I was.
And that was just last week in Orlando, and you were one of the finalists from more than 200 different applicants, is what I understand. So talk to me a little bit about that experience. What did you learn? How did the panel respond to this product? What kind of feedback did you get?
Well, the response was great, which we've seen now for a while. So as a company, Catalia Health, we're several years old. This product actually starts shipping to patients in a few weeks.
Oh, no kidding.
Yeah.
Right.
So this is actually a production version.
Thank
you. It's taken a long ways to get here. Now, right now our customers are largely pharma manufacturers and healthcare systems.
Okay.
Right, so another part of the healthcare world versus GuideWell on the payer side.
So is this integrating into pharma as a medication adherence piece? Or?
Correct.
Okay.
Right, so ultimately what we're doing with Maybu is helping keep patients on therapy and out of the hospital for longer. So that's a clear problem for pharma and for healthcare systems, right? Respectively, those two issues. Now, as we scale this up to a larger number of patients, the payer is interested, right? In terms of how we provide better low-cost care to a larger number of patients. So being in Orlando last week was to let us better understand that relationship and how this is going to fit into the way that a payer is viewing the world in 2017.
And what did you learn from that? Because I do think that it's interesting that other startups can draw some corollaries from that, because payers are typically, they're kind of hard to access, and it's hard to get some good feedback on your innovation. So tell me some of the things that you learned. What were some of your key takeaways in terms of working with the payer?
Well, one of the great things last week was just access to executives across GuideWell.
Okay.
Right? And being able to see, right, because talking about a payer is kind of one way to look at it, but different parts of that organization are looking at things in different ways.
And Cory, real quick, I wanted, for everybody who's watching, I just want to clarify, GuideWell is a health solutions company that has underneath it a payer. It does have Florida Blue, which is Florida's Blue Cross Blue Shield plan, but they also have a care delivery company, they've got a consumer solutions company, they've got a pop health company now, and so you really do get a broad array of execs. So I just want to clarify that for those who don't know what GuideWell is.
That's perfect, right?
Okay,
because
so thank you.
If you're in any of those companies, and even say within Florida Blue, there are different different people looking at the world in different ways,
Right.
Are we trying to be innovative and bring something completely new to patients and be a leader in this space and how we provide care? And GuideWell and Florida Blue are trying to do that. Are we looking at best outcomes and how exactly, and how do we get the best outcomes for our patients? And there's a part of it there. And then for us as a company, if we're looking at how the payer looks at things that maybe be first to hundreds or thousands of patients starting as a pilot, that's one thing. But if you want to use this for hundreds of thousands or millions of tens of millions of patients, how do you integrate in the right way? Who pays for it?
Right.
Why do they pay for it? Right? Because that's changing a lot in terms of the U.S. healthcare system.
No, and that's very insightful, and I do think that other startups can kind of draw from that and apply it to their own situation. Any other advice that you would give to a startup in your situation? I understand that, you guys are at the point where you're shipping product out.
Yeah.
So you're scaling. Congratulations on that. Any words to the wise that you'd like to send back?
Well, something actually related to what we were just talking about. Figure out, if you're building a new product, right? This is obviously very new and unique, right?
Yes.
In terms of the interface. There's nothing like this on the market. It goes back to research I was doing more than a decade ago. So that's great. But in terms of healthcare, right? Healthcare is big overall, right? $3 trillion in the US. Figure out exactly where you fit in.
Yep.
From a business model perspective, at Catalia Health, we're doing nothing new, right? We've figured out where care management programs exist today, who's paying for them, what those contracts look like, and how do we fit into that space. And that makes a big difference if you want to be able to grow and fit into healthcare today as a company.
Exactly. Well, Cory, thank you so much, and thank you for bringing along little, what was it again?
Mabu.
I was going to say Wagyu, and I was like, no, I think that's beef.
Very close.
Thank you so much for bringing her along and letting us meet her. It's a pleasure to have you here in the GuideWell Innovation Insights Lounge here at Exponential Medicine 2017. Thanks so much.
Thank you.
Thank you.